Hi, my research proposal is on communities of practice in an asynchronous e-learning course for prep navigators. As I realize this could be a subject that is not familiar to most, there are a few definitions that we will go over. The first is pre-exposure prophylaxis or PrEP, and I'll be referring to this as PrEP throughout the presentation. But PrEP is a medication that, if taken regularly, it can prevent HIV. PrEP navigators are professionals who are an integral part of connecting those at high risk of contracting the HIV virus with PrEP, as well as other prevention strategies. They also connect those who have tested positive for HIV with the appropriate care. Communities of practice are groups of professionals who share the same passions and work together to construct knowledge. Pre-exposure prophylaxis, or PrEP, is a medication that can prevent HIV. PrEP is highly effective, yet it is underutilized, specifically in the populations of highest risk. PrEP navigators are people with come from various backgrounds. Some could be community healthcare workers who, because they are in communities, they are very effective PrEP navigators. They may not have the advanced degrees, but their relationship with people in the community allow them to be extremely effective as navigators. And physicians could also be PrEP navigators. So there's a very diverse group that makes up PrEP navigators. They work to ensure that those that their clients who are at highest risk of contracting HIV have are linked with the appropriate prevention methods, including the medication PrEP. There is a shortage of PrEP navigators, and so online courses are very important to allow them to access the information that they need to train new PrEP navigators, to help those who are currently in the field get updated information, and to be able to access that at a time and a place that is convenient for them. However, when they are already working in a profession that can be very isolating, these online communities don't provide the same sort of collaboration that allows those who attend in-person training to feel less isolated. So virtual communities of practice within e-learning courses could be very beneficial to PrEP navigators. The purpose of this explanatory mixed methods study is to address the effectiveness of communities of practice in e-learning courses specifically designed for PrEP navigators. The research questions that will be answered in this study are: to what extent does participation in virtual communities of practice affect understanding of current protocols in HIV treatment, implementation of these protocols, retention of PrEP navigators in the workforce? How does using discussion forums in asynchronous courses versus live video conferences affect the sharing of knowledge of PrEP navigators? And what characteristics of virtual platforms most effectively support retention of knowledge by PrEP navigators and the implementation of current protocols? This study is informed by communities of practice, which is a social learning theory that emerged from constructivism. Communities of practice is a persistent, sustaining social network of individuals who share and develop an overlapping knowledge base, set of beliefs, values, history, and experiences focused on a common practice or mutual enterprise. Within these communities, learners with shared passions work together to construct knowledge. And as medicine is a collaborative profession, Learning communities of practice enables the learner to grow accustomed to doing this. This is something that is done often in in-person settings. However, the online settings do not necessarily facilitate this. And this would be an important component of e-learning courses for fields that, specifically those that lack sufficient workers, to be able to get the same benefits as those who are in an area where there are many trainings they're able to attend in person. While there was not much literature about specifically using communities of practice in online courses designed for prep navigators, I reviewed literature in two different areas: communities of practice in medical education and online continuing medical education for HIV practitioners. So, online learning is a preferred method of continuing medical education because the medical professionals whose lives are extremely busy are able to access it at their own convenience. But many times, this online learning lacks the collaborative component. So, in a study that involved general practitioners, there was a forum that was created that facilitated this collaboration. And so the practitioners were able to collaborate at times convenient to them because the forum was always open during the course. And that was a component of the course at the end of the study. That was a component that made them feel that they actually learned more because they were able to go beyond just what was presented in the course. An additional study noticed this benefit, but also noticed that that benefit could be taken away without careful monitoring in the case that a negative discussion were to begin in the forum. For HIV practitioners, there are examples of online continuing medical education, and they also do prefer that. But there's not much literature about communities of practice within the courses. Some collaborative components have been added to courses, and other courses have facilitated collaboration through hybrid courses. So the learners attended the courses online, and then they met together after the course to deepen their knowledge and work together. But this would not work in a course where the participants were spread across the country. Some of the gaps in this literature is there is a gap in understanding the impact of communities of practice in e-learning courses for medical professionals. But there is a significant gap in understanding their impact in e-learning courses for prep navigators and other HIV professionals. So the study aims to implement the communities of practice in an online certification program for prep navigators. Within this course, there will be discussion forums and live video discussions implemented within the modules or after the modules are completed. This collaboration will allow learners to work together to construct knowledge, to deepen their understanding, and to share experiences and come up with, expand their toolkit to reach their clients with the overall goal to reduce the rate of HIV transmission as well as to link their current clients to appropriate care. This study will be using explanatory mixed method design, which will begin with quantitative data collection and analysis, and then will be followed by quantitative data collection and analysis. The qualitative data collection will be informed by the first phase, the quantitative phase, and that will guide the questions for the forums and the interviews. The research design, it will be housed in the Moodle Learning Management System, and there will be 100 30 participants, they will be chosen on a voluntary basis and divided into 65 in control group and 65 into the study. They will be from diverse backgrounds and they will all be PrEP navigators. All participants will complete a pre-test, e-learning modules, post-test, and a survey for 8 modules. And then the study participants will participate in forums, discussion forums, and live video discussion throughout the study. The first phase of data collection will involve administering pre-test, post-test, and quantitative survey questions. That data will be analyzed and then it will inform the second phase of data collection, which will be the qualitative phase. It is anticipated that the qualitative phase will include open-ended survey questions, virtual focus groups, and virtual interviews. After the completion of the study, it's expected that when compared to the control group, the study participants will have increased confidence in their abilities as PrEP navigators and will have a whole new toolkit to handle challenging situations and be able to more easily connect their clients to appropriate care, and that they will experience less burnout and remain in the field longer. So the implications, using the advances in instructional technology have made these online courses possible, and they have created collaborative tools that can be easily integrated into online courses. As technology continues to change and change rapidly, it is expected that there will be new technologies that will be able to do this even better. And so as studies continue, future research could be using different collaborative tools and noting their effectiveness, as well as incorporating generative AI in the participant selection process, as well as the determination of the data collection focus for the qualitative phase. A limitation of the study was that it used a small sample within one online course. So with the diversity of PrEP navigators, there are many across the country and from different backgrounds, so it is very possible it was not a full sample that was completely representative of this group. In conclusion, communities of practice have been an integral part of medical education, and advances in instructional technology have created tools that allow these communities to be integrated into asynchronous e-learning courses. PrEP navigators are professionals and they have diverse backgrounds, and they are focused on helping those at risk of acquiring HIV. And as there is a shortage of PrEP navigators, the online courses, especially with the collaborative component, will be instrumental in training and helping them keep up with current practices. So the communities of practice within the e-learning courses can offer the social learning opportunities that they need, and social learning can offer the knowledge and connections needed to improve practice and decrease burnout.